This is Dr. Solomon, another session of Your Health Today. Today we're going to discuss something that touches a lot of us. We will be talking about diabetes. And when we say the word diabetes, a lot of things come to mind. So we will start, what is danger about diabetes? What is the danger of diabetes? You know, the things that most of us seen if we have a friend or a family member with diabetes is the coma. Okay, and patients have diabetic coma for 4 different reasons. We will discuss all 4 of them today and we will see. But before we do that, I just want to explain what is diabetes. How can someone have diabetes and why can someone have diabetes? What is the mechanism of the disease? How can the disease happen? When we talk about diabetes, we're talking about excess sugar, especially glucose in the blood. That's what diabetes is. There are numbers that we put. If you exceed this number, then you have diabetes. So diabetes developed because of what? There is a very small gland right in the middle of your chest, right here, okay, under the diaphragm, called pancreas. And this pancreas have specific factories for a substance called insulin. Is that insulin that is the key to open the cell and allow the sugar inside. So each cell has a key and a lock, is locked. No sugar can enter that cell unless you open the key. And the key in this case is insulin. Exactly like I'm saying. If we lose the key, if something happened to the key, if the key get defected, insulin cannot enter. Sugar cannot enter. The glucose cannot enter. What about the lock where you insert the key? If that lock get bad somehow, as well, glucose cannot enter. So we have 2 scenarios here we have discussed. Is either the key is bad, where you open the door to the cell and allow the sugar inside. And by the way, the sugar goes on with the sodium. Okay, sugar and sodium go in the same direction. Okay, as well as potassium, and we talk about that. So, let me repeat. What is the relevance of glucose? It's very relevant. Glucose inside the blood, in the blood, is no use for me. I have to have the glucose inside the cell to produce energy, to move on. I am talking to you right now. I am exhausting energy. I am utilizing energy. The only way I can talk and move is by utilizing energy. And the energy comes from glucose. And the glucose comes from food. No food, no glucose, no energy. What about if I stay silent, like I'm sleeping? Do I still need glucose? Absolutely. Because when you're not moving, there are other things in your system that are moving. Your heart is beating, right? 80 beats per minute. That requires energy. Energy comes from glucose, so we need glucose. Your intestine is moving. We need glucose for that intestine to move. So bottom line is, if there is no food, there is no glucose, you cannot have energy for anything. Forget about the external muscular movement. We're talking about other things, the metabolic process in your body. When you eat something and it gets digested and then you use whatever elements you use, this is all metabolism and it needs energy. So everything, even if you're not moving a finger, you still need energy. If you open your eyes, you need energy, and energy comes from glucose. So glucose is very essential for us. And that glucose comes from food. Yes? So it's very essential for us. The only organ in your body that does not need glucose, guess what? does not need insulin to have the glucose enter is the brain. And the brain is a major organ in our body, and we need the brain at all given times. And this is, the brain does not have to ask for insulin. The cells of the brain do not have a key and a lock like the different other cells in your body. They do not need permission from insulin for the glucose to enter. No, they don't. So that is why the brain is very essential for us, and God gives us the capacity to use our brain even when we do not have insulin, or even when we have big resistance to insulin. So this is the brain. No need for insulin for the sugar to enter our brain, because we need to use the brain a lot. The brain is the control room for everything that goes on into your body. So we cannot rely in insulin. What if it gets defected, like in diabetic patients, then the brain will stop? No, it's not the solution. So God provided us with a brain that does not need insulin for the sugar to enter. The sugar in the blood enters freely. So that is the importance of glucose. We need glucose to breathe. We need glucose to move. We need glucose for our heart to beat. We need glucose for our metabolic process. When you digest your food, when you use that digested food, when you build your cells, when you renovate anything in your body, we need that glucose. So glucose is essential. But where? Inside the cell. And for that, like we have said, we need a key, which is the insulin. We need to open the door for the cell, which is the receptor for insulin. So if something happened to the key, we cannot get glucose inside the cell. If something happened to the lock where you insert the key, we cannot get glucose into our cells. The only exemption is the brain. The brain does not need your insulin, does not need your insulin. So there is another thing I would like to add, but we'll talk about this in a bit. But, let's compare just two organs quick to see the greatness of God. The heart, it beats, and in the process, it needs energy. It utilizes glucose. The kidney. And the kidney goes through 180 liters of blood in a day. Yes, you heard correct. 180 liters of blood in a day. It shifts all the blood in your system total to about 180 liters. Many times, of course, when you add them up, it comes to about 180 liters a day. And guess what? The kidney does not need energy. And this is the miracle of the kidney. If the kidney, remember, if you have a water pump in your house, like a borehole, and you want to take water and shifter this water, how much electricity you will use? That is energy. How much you will use? You will use a lot. But for the kidney, you do not need. Why? Because when God made the kidney, He made the end, which is the pipe that goes in, we call the arteriole, or the artery, is bigger, is wider. The diameter is bigger. And then after the blood gets shifted, kidney is a shifter. After the blood gets shifted, it goes to a lesser diameter vein. So one vessel coming in with the blood, big diameter, and another vessel going out, smaller diameter. So from big diameter to smaller diameter, we're creating pressure inside that kidney. And this is what we call filtration. The filtration takes place automatically without the need for glucose. Amazing, right? Amazing. So this is one organ that does not need your glucose, does not need your insulin. It shifts our blood 180 liters a day without any problem, without the need for glucose. And if I don't need glucose, I definitely do not need insulin. And on the other hand, we talk about organ that relies heavily on glucose, which is the brain. It's your computer in the body. So we have to have glucose. What if? So this is the normal scenarios. Now let's go to the what if. What if the glucose go low? The brain will not get his enough glucose. The brain will go into coma. In the process, of course, you feel dizzy, you feel blackout, you feel a lot of other symptoms, but at the end of the day, if that glucose goes very low, then you definitely will have a coma. And that's what we call a diabetic coma. A diabetic coma. So there is a diabetic coma, because the glucose is not supplied in well enough quantities to the brain. And that type, we call it in medicine hypo means low, glycemic means low sugar coma. So your brain has lost its consciousness, ceased to work, because the supply of glucose, which is the main power, the main energy, has been shut down. So this is the first type of coma that can happen to a diabetic patient, which is the hypoglycemic coma. So one day I walk into the clinic. I see at the minute I walk in, it's just like the patient was waiting for me. The patient dropped from the chair on the floor. Boom. What is the first thing that comes to mind? The patient has no relatives with him. So you cannot ask, because the first question will be, is the patient diabetic? That is the first question. When you have somebody who was sitting down and boom, collapse on the floor like that. So is the patient diabetic? The patient has no family. The patient now is in coma, cannot talk. So what is the first thing we rush to do? Oh, let me have the sugar. Let me have the sugar. Let me measure the sugar and see. Well, the patient is hypoglycemic. A little bit of sugar or glucose or anything that's sweet in the mouth and everything that we can touch his mouth, the patient will recover. The patient is up, it's fine. So it was a hypoglycemic coma. Now, why I want to stress out the hypoglycemic coma as very important thing? Because there is a lot of mistakes that we have noticed in the patient behalf. That and sometimes, I also have to, say something about the health professionals that using aggressive dose in the evening. In the morning is okay because everybody is up. If anything happens, if the patient goes into hypoglycemic coma, we will know. It's very easy treatment. I can revive him back with very small sweet things, juice, honey, anything that is sweet will revive. Anything that supply the patient with a little bit of sugar would revive the patient back. But here is the issue here, and I want you to pay very close attention. Here is the issue. What if this happened when the patient is asleep? So the patient asleep goes into hypoglycemic coma while he's asleep. There is a big chance this patient will never wake up. Right? There is a big chance this patient will never wake up. For the reason being, he's not up. Nobody witnessed anything. The coma, sleep, continue with the coma, and the patient is gone. So very bad consequences could be death. So that is why I want to stress out something. If you're taking insulin or you're taking diabetic medication, most of the dose is in the daytime. Nighttime, very light dose or none. Why? Because if you go into hyperglycemia, meaning too much sugar in the blood, I can control you over a day, 2, 3, is no problem. It's not going to kill you. But if you go into hypoglycemia, and you sleep and nobody knows, because there are symptoms that come with the hypoglycemia. Everybody who's diabetic will tell you, they feel hunger, they feel tremoring, they know. They are very anxious. They know when the hypoglycemic shock or the hypoglycemic attack comes, every diabetic patient will know better than the doctor that they are going into hypoglycemia. So they will know. So they immediately take something sweet and reverse the sugar back to normal values. So I cannot stress out enough. The night dose or the evening dose, if you are taking insulin or you are taking tablet, has to be very adjusted. Has to be the lowest possible. We can live with hyper, meaning more sugar. We cannot live with low sugar. Because, for the reason I just explained a minute ago, the brain needs glucose to survive. The only source of energy for the brain is glucose. Glucose is finished, your brain is finished, and you go into hypoglycemic coma. Now, if you have somebody who is in the daytime and collapse like this, you know it's hypoglycemic shock. If you don't have access to sugar measurement machine, then you just give the patient a little bit of sugar. Even if the sugar was high, it will not hurt him. But if the sugar was low, it will save him or save her. I hope we understood this concept and understood this advice very well, because it's a common thing that most of us fell into and we cannot revive back. And sometimes we lose the patient because of a simple mistake. Let me add one more thing before I go into my break. God has provided us with another mechanism when the sugar goes down, called glycogen lysis, meaning I'm breaking glycogen that is stored in my liver, and whereby I break it into the simplest form into glucose, and that will save the situation. So sometimes I wake up in the morning after taking the evening dose and I find my sugar adjusted. I find my sugar value is good, and I think the doctor is doing a good job because the sugar in the morning is okay. This is actually, in most of the cases, not correct. It's because of that process called glycogenolysis, that where I break down glycogen from my liver, turn it into glucose, because the body, while you're sleeping, was in bad need for glucose. And the only way, since you cannot eat when you sleep, the only way the body can save you is to destroy and break down some of the glycogen in the liver to supply you your quantity needed to recover the hypoglycemia. And that is what we call the smudge effect. So what is the advice here? You wake up at 2 o'clock in the morning few nights and take your sugar level and see if it's low or not. Adjust. So you cannot wake up, have somebody wake you up. And take your sugar level at 2 o'clock in the morning. Repeat that many times to make sure that the evening dose does not bring you to hypoglycemia. Very essential. Everybody who's diabetic should be listening to this very carefully. You wake up at 2 or 3 o'clock in the morning, you take the sugar level. Make sure you are not hypo. If you are hypo, then we need to adjust the dose of insulin or the dose of the tablets you take it. And there are, like I said, there are two mechanisms of the disease, one of which we lost the key to enter the cell, and the other one we lost the lock that attached to the cell.